Hi, parents. Welcome to the Parent Guide, helping your teen overcome pornography addiction. I am your host, Matt Bulkley, a licensed psychotherapist. Past 25 years, been working with families just like yours. You're navigating the choppy waters of your teen struggles with pornography or gaming or excessive technology use, common struggles in 2026. You are in the right place. And remember, we're here to provide practical tools, hope, and a path forward without judgment. And today, we're going to take a deep dive into what I think to be one of the most powerful tools in my therapeutic toolkit, something that I use as a clinician every day in virtually every session that I conduct, and that is the concept and the skill of reflective listening. And this isn't just some feel-good technique. My estimation, it is a game changer for turning explosive arguments into genuine connections. We'll explore why reflective listening works, back it up with research, identify the core principles, and give you 6 practical techniques that you as a parent can use in your interactions with your teen. Want to give you some real world examples, how you can apply it specifically to pornography, gaming, and tech addiction situations, and give you some case scenarios from my practice, along with tips for staying calm, and also when you know it's time to seek professional help. So if you've ever felt like you're talking to a wall, or worse, like every conversation ends in a slam door, then this episode is for you. I hope that this becomes a game changer for you. Stay around. By the end, you will have some actionable steps to start rebuilding that bridge with your teen. So let's get into it. First, let's talk about why reflective listening is so crucial, especially when dealing with sensitive topics like pornography or gaming or screen addiction, which so often has the potential to turn into major conflicts. And as parents, our instinct is to jump in with advice or to lay down rules or to lecture. Things like, well, just turn that off, or can't you see this is ruining your life? The research shows that approach usually backfires, especially with teens. Their brains are wired for independence, and things like feeling judged or controlled so often triggers defensiveness, them shutting down or lashing out in anger. This concept of reflective listening flips that script. It's an active way of showing empathy and validating their feelings, even if they're wrong, and confirming that you understand without immediately jumping in and trying to fix them. And studies from the field of motivational interviewing, which is a specific counseling intervention that relies heavily on reflective listening, it demonstrates its effectiveness in adolescent therapy and also in addiction recovery therapy. So, for instance, in 2014, about 12 years ago, there's a study published in the Journal of Consulting and Clinical Psychology, and it found that group motivational interviewing, which emphasizes reflective listening, significantly increased change talk among teens struggling with addiction issues. Teens started expressing more motivation to change because they felt heard and not lectured. So this extends to behavioral addictions like porn and gaming. In a more recent study in 2023 in the Journal of Addictive Behaviors highlighted how empathetic communication, including reflective listening, reduced defensiveness in teens with gaming disorder, leading to better engagement in treatment. So let's look at the stats on these issues just to understand the scale here. And I think I've shared this in a previous podcast. Common Sense Media survey showed 54% of teens have seen pornography by age 13, with the average exposure more in that 11 to 12 range. And for gaming, there's a Pew Research study, 2024, reported 85% of U.S. teens play video games, with 41% doing so daily. And in estimates of gaming addiction, around 8 to 9% of teens under 18. And then on screens overall, teens, this one is pretty mind-blowing, but teens average over 7 hours a day, with a WHO report from 2024, 2 years ago, showing that 11% exhibit problematic social media use, which links to higher rates of anxiety and depression. So when teens feel ashamed, like many do, especially with porn, and we know I mean, 93% of boys, 62% of girls exposed before age 18, that they withdraw. When they feel ashamed, they withdraw. And reflective listening builds trust, it reduces that shame, and opens the door to collaboration. And it's a little tricky because it's not about approving the behavior. It's about understanding the person. In fact, I can tell you as a clinician, this happens to me every day whereas I'm sitting in session and the client is talking about something that I don't approve. And in my mind, clearly my conclusions are, no, that's not accurate. That's not accurate. But I don't come out and say it. I'm focused on understanding that person first. And then in time, there is a time and a place where the behavior is challenged. And as there's study from Hazelton, the Betty Ford Foundation noted that empathy through reflective listening helps adolescents stay in treatment longer and engage more deeply, which is key for recovery. So in other words, if as a clinician, the first time that something comes up that I don't agree with, that I challenge, the chances are that client is not going to continue to come to therapy. So the challenge has to be timed right, with the main focus in the beginning being reflective listening and trust building. Well, let's break down the core principles of what reflective listening is. It's built on a foundation of presence and empathy. So number one would be this: to focus fully on your teen. And what this means is no distractions. So put away your phone, make eye contact, and be in the moment. It's not multitasking, it is focusing fully on your teen. That's one of the advantages of a therapy setting is that for an entire hour, the therapist's focus is completely on the client. Number two, listen to both the words and the emotions underneath, because teens often say one thing but feel another. So being able to observe the emotions that are underneath, not just taking in the words and taking them face value. Number three is to reflect back what you hear to confirm the understanding. So in other words, it's not just simply parroting back, but it is just summarizing what you have heard in your own words. Number four, avoid interrupting or avoid judging. So, this would be eliminate. There's no buts. There's no, well, you should, right away. Even if you disagree with it, even if you do not like what you're hearing, you avoid interrupting and you avoid the judging. Number five is to ask open-ended questions to encourage more sharing. Things like, well, what makes that tough? Instead of yes, no queries. Number six, validate their emotions, even if you disagree with the behavior. So in other words, it would be saying something like, well, it sounds like you're really frustrated. And that doesn't mean that you're condoning whatever the behavior is. And these principles, they really do come straight from some of the clinical and counseling training, like the motivational interviewing research that I talked about. A 2025 Frontiers in Adolescent Medicine study on recovery capital for teens, which emphasized how building social connections through empathetic listening enhances overall well-being and reduces addiction risks. So whether it's coming through a therapist or through you as a parent, the research backs up reflective listening. Now let's get practical with 6 techniques that you can use starting today, and I'll explain each and give some examples and tie in a little bit of research or statistics for context on this. So technique number 1 would be paraphrasing. So this means that you're restating what they said, but it's in your own words, and this is to show that you're paying attention. It clarifies, helps build rapport, helps build trust. So an example would be something to the effect of, your teen says, well, I just game to chill after school. It's not a big deal. And you would respond, well, so it sounds like your gaming is your way to unwind from a stressful day. It's simple, right? And there was an article from the American Psychological Association on gaming interventions that noted that this reduces conflict by just simply acknowledging positives first. And this, when this happened in this Monitor article, 41% of the highly addicted gamers surveyed felt less attacked. Technique number 2 would be reflecting feelings. So this would be name the emotions that you sense, even if it's unspoken. So this shows empathy and it helps them to process So an example would be maybe your teen snaps, "Well, you don't get it. Everyone watches stuff online." And you would say something effective, "Well, it seems like you're feeling defensive or maybe be embarrassed about this." And so, the research on this, there's a journal from the American Medical Association, JAMA, a study that linked addictive screen use to a doubled suicide risk in teens. So simply reflecting feelings can de-escalate what sometimes can move into an emotional spiral. Technique number 3 would be summarizing. So after they've shared, you're going to want to recap the key points to keep aligned. So example would be so from what you said, porn helps you to deal with boredom, but it's starting to make you feel guilty and isolated. And so this kind of response would mirror a technique that's part of smart recovery programs for youth, where simply summarizing encourages self-reflection and has been shown to reduce addictive behaviors. Technique number 4 would be ask open-ended questions. So these invite depth, not quick answers. We want depth. We want them to expound things. So an example would be asking the question of, well, what draws you to those games? Or how does scrolling make you feel at the end of the day? There was a study in 2025 in the Frontiers in Child and Adolescent Psychiatry that found open-ended questions help teens to explore the motivations behind porn use, where 22% of those surveyed, these teens viewed it frequently. And technique number 5, avoiding judgment and advice initially. So I'm not saying indefinitely, I'm saying initially. So you focus on understanding before offering solutions. So in other words, instead of something like, well, you're wasting your life on screens, try something more like, well, tell me more about what technology means to you. This aligns with a strategies report from Norton Healthcare, which stressed non-confrontational language to engage teens in, and this was more focused on substance addiction discussions, but it had found that was a helpful intervention. And then finally, technique number 6, using using minimal encouragers. So in other words, this would be things like small nods, just kind of the quick, "Well, I see," or, "Huh, that makes sense," or, "Go on." And they keep the conversation flowing without interruption. So it's just kind of the verbal and nonverbal body language and the communication that says, "I'm with you, keep going, I hear you, I hear you." And these techniques, when practiced, can transform the interactions. So remember, it's about creating safety. Teens struggling with addiction often feel isolated and alone. And so sometimes these small verbal and nonverbals can help with that feeling connected and validated and heard. Well, let's bring this to life. I want to share just a few, and of course, these are all the names are anonymized for confidentiality sake, but it's case scenarios just here in the last few months that I've encountered in my practice. So case 1, call him Alex, a 15-year-old boy struggling with pornography addiction. His parents had caught him multiple times using pornography, and he had told him that he'd stop, but he would continue to fall into it and break rules, beat the technology restrictions that they put in place, which then would lead to yelling matches. And so in working with his parents and teaching the concept of reflective listening, when his mom started using reflective listening, um, so, after Alex would say, "Well, it's not hurting anyone," she responded with something effective. "Well, it sounds like you see it as harmless fun, but maybe you're worried about getting caught." And over weeks, this opened up talks about his curiosity and stress from school, which seemed to be the underlying drivers for his pornography addiction. And with consistent empathy, Alex, from his parents, Alex reduced his viewing. I mean, it was going on daily to it was cut back to very, very infrequently. And as they participated in therapy sessions, it continued to get better and better with their communication becoming more frequent. So case number 2, we'll call him Sam, 16-year-old. And it was more gaming in his issue. Gaming to the point where it was many, many hours a day, skipping meals, staying up all night, grades were dropping. And his dad started to work on using reflective listening with just kind of comments the effect of, well, it seems like gaming connects you with friends online, but it's pulling you away from real life stuff. And as he approached it with empathy and continuing to use reflective listening and understanding, it led to Sam being able to acknowledge his deep feelings of loneliness, which was being filled with the online gaming. And so over time, they set boundaries together, and the frequency of his hour after hour after hour gaming started to decrease. And then finally, Jordan, 14-year-old boy, tech addiction, constant scrolling, constant screen time. Parents implemented reflective listening in their interactions with him. Things like, well, you seem overwhelmed when your phone buzzes nonstop. And Jordan opened up about basically just the whole FOMO phenomena, the fear of missing out. And as they used open-ended questions and helped him explore other alternatives, developing some new hobbies slowly, but over a period of multiple months, his screen time really started to decrease. Mental health improved, and he was able to find satisfaction in real to life activities rather than the constant screen time. So parents, do keep in mind, it does take time. These cases show progress. It shows it takes time, but reflective listening with their teens laid the foundation for the progress to begin to happen. So now let's apply this specific to addiction. So for example, pornography, a really important thing to focus on is to acknowledge the shame without blame. This might sound like something like, well, it sounds like you're curious but confused. With gaming, maybe the way you approach gaming, validating the need for escape, like gaming relaxes you and it helps you build friendships. What is it that makes it hard to stop? And then maybe it's for, just a more general tech addiction, screen time, it would be showing empathy and understanding for the connectivity phenomena. So something like, well, seems like your phone keeps you linked. What is it that helps you to unplug? And along those lines, just a few other, kind of tips to stay calm. Like one important thing is choose quiet times, breathe deeply, use I statements like, well, I worry because I care. The I statement puts the focus on not them, but you. And then do keep this in mind, parents. If despite your best intervention with reflective listening, if issues persist, particularly with things like declining school grades, sleep problems, relationship problems, do seek help. Connecting with a clinical professional that's comfortable and experienced and working with teen mental health and addiction issues can be so helpful. And particularly if the issue is pornography, utilize the recovery toolbox for teens. It includes the Breaking Free workbook, parent guide, the 101 tips for quitting porn. It's a trio of workbooks. You can use it as a parent-led intervention. You can use it in your home with you being the primary driver with that, or you can use it in conjunction with a therapist. It's the same curriculum that we use here at Therapy Associates in the clinic and in Star Guides, our wilderness program. And if you're in Utah, Therapy Associates here in St. George, we have several skilled clinicians that specialize in teen pornography addiction issues. And if you're out of Utah, you know what? Find a therapist that works with teens and introduce them to the recovery toolbox for teens and ask them to incorporate that and to use that as a guide for the treatment process. And in cases that do require more intensive or immediate intervention, then our Star Guides Wilderness program is a great option. It's in circumstances where serious safety risks or unmanageable behavior issues are present, things like sexual acting out or sexual abuse, engaging in high-risk online behaviors, severe mental health issues, things like suicidality or self-harm, or debilitating patterns of anxiety or depression, or when a teen has just simply become entirely unresponsive to your parental authority, and maybe this cycle of addictive or compulsive behaviors can just simply no longer be safely interrupted in the home setting, then an intensive, highly structured therapeutic intervention like Star Guides is often the next step. And that's what Star Guides provides, just that. It's a clinically sophisticated wilderness-based program specifically designed to stabilize acute risk issues and restore emotional regulation and create that ultimate kind of digital detox and reset, begin to rebuild healthy family dynamics when outpatient or home-based interventions are just not working. I go to the field Mondays and Thursdays, spend my days out there, and I've seen remarkable turnarounds, and it becomes the turning point towards lasting healing. Parents, remember, reflective listening has the potential to turn some of these conflicts and battles and arguments into bridges. And so start small. We've covered multiple techniques today. Try one today. Remember, you're not alone. You're doing vital work. I hope this has been helpful. I know that I use reflective listening every day in my clinical work, and I know what a valuable tool it can be. So thanks for tuning in today. I know that your time is valuable, and I hope that you have found something helpful. Make sure to subscribe and tune in weekly, either on the podcast or on the YouTube channel, for tips, research, strategies, guidance, and support in this journey with your teen. Remember, what's one technique you'll try today? Parents, thanks for listening, and take care.